what I wanted to cover today was the types of medical hypnosis that is out there, what exactly is chronic disease, so that we're all very aware of what we're doing and what area we're focusing on, and then the different styles that are being used in medical hypnotherapy for chronic disease, because they're actually very, very different. And you'll notice that depending on a practitioner's paradigm will pretty much dictate how, of course, what strategies they will use. So these are the types of medical hypnosis and hypnotherapy, the main groups that are out there. You have hypnotherapists that very much specialize in pain management, right, and symptom management. There are hypnotherapists that work a lot in emergency rooms for emergency hypnosis, to stop bleeding, to keep a person from getting into shock, right, to keep a person relaxed. Any kind of intervention in the emergency room, for example, needles and stuff, to help in that case and to reduce pain immediately. We also have in medical hypnosis, hypnobirthing. Jamie did a course in hypnobirthing and specializes in that. Pre and post surgery. And again, Evelyn mentioned that she does a lot of that, right, to accelerate the healing. We also have medical hypnotherapy in dentistry to substitute Novocaine, for example, or some people fear dentists, right? And hospital work in general. Again, there's people that have phobia or claustrophobia to MRI machines, and all those elements are also being used and a group under medical hypnotherapy. And then what we're going to be focusing on is hypnotherapy for chronic disease. In order to do that, before I continue, actually, I wanted to just briefly explain why I got into chronic disease rather than, for example, into any of these. Has anyone here, and just nod your head profusely and I can see you, has anyone here ever done the allergy process, the NLP allergy process? Okay, I definitely recommend you explore that, because the thing with the allergy process, that's how I started. I had been taught the allergy process, which is a NLP process in which you help a client seeing themselves out there, you walk them out of an allergy. And I did that with a friend while I was studying. And in 30 minutes, we eliminated his 35-year, very chronic cat allergy. It was so bad he was taking medication daily and had to always carry an inhaler with him. And 30 minutes after the session, we went outside and there was a Persian cat and he petted it for about 15 minutes. So that was quite a shocker to do and to witness, because we were not symptom managing anything, right? We weren't lowering a reaction of his body. We had walked his immune system literally out of overreacting to cat hairs. And from that moment on, all I wanted to do is I kept questioning, what else can we do? What else can we do with the immune system? Can we walk the immune system out of a lupus, out of multiple sclerosis, out of arthritis? Most chronic disease has an immune system component, right? So if we could do that with allergies, what else could we do? And that's when I began this whole exploration of chronic disease, taking every single class out there to see what else had others done. I started looking for what else is possible, and I didn't find very much, because most people, most hypnotherapists, when it comes to an autoimmune disorder or other chronic diseases, are trying to just manage symptoms. But I knew there had to be more, because the allergy process definitely showed it. Raynaud's. Raynaud's is when it's very cold out. Some people's, it's like their blood cuts off from their fingertips and their toes and it becomes deathly white. And I actually used the same process with Raynaud's, and it worked. For 2 years, she had no more Raynaud's, and she used to have it continuously whenever it was slightly cold or she had to go outside, and do something outside, she actually found that she couldn't use her fingertips because they were so numb she couldn't even feel them, right? And so it worked there too. So I was on a roll to see, well, what else can I do, right? Other chronic diseases gets a little more complicated than that. So to continue, let's figure out exactly what is chronic disease. Let's define it precisely so we know what our area is going to be. So what is chronic disease? This is actually the definition from MedicineNet of what is chronic disease. Chronic disease is a non-viral and non-infectious disease. Now, what's interesting about that is you will notice that a lot of scientists, a lot of medical research is searching for the virus still, even though MedicineNet has defined it, and other medical, you'll see other medical sources define a chronic disease as being non-viral. For example, in MS, you will find a lot of relationship of MS with Lyme, but not everyone with Lyme has MS, or the Epstein-Barr virus. But if more than 80% of adults have Epstein-Barr virus, and not that large of a percentage of those adults have MS, right? But there's always that search for the virus. However, chronic disease is defined by not being viral. It also lasts more than 3 months. So there's a big difference, and you'll notice it as we do our work. There's a big difference of having a client come in who has a neck pain from a car accident they had a month ago, or a client that comes in who has intermittent neck pains for the last 30 months. It's a very different ballgame, and that's what I really want to get some clarity today about. What is that difference that makes the difference? And interesting, this is quoted verbatim by medicinenet.com. It cannot be cured by medication. Chronic disease cannot be cured by medication. I wrote here some examples of chronic diseases. All the autoimmune diseases, arthritis, Hashimoto's, lupus, MS, heart disease, major, I think it's the #1 cause, right, of death, stroke. All the cancers are within the realm of chronic disease. Diabetes, Parkinson, all the chronic pains like fibromyalgia, back pains, all these pains, all of this is within the realm of chronic disease. Why is this? Why would we consider this to be a good niche to specialize in? I've had practitioners tell me, well, why would you want to, pigeon-toe yourself or narrow yourselves to such a small field? Well, let me show you some data about this field. As of 2012, half of all Americans in the US, half, have 1 or more chronic health conditions. It is not a small field. 1 in 4 have more than 2 or more. 7 of the top 10 causes of death were chronic diseases. And 2 of them, heart disease and cancer, account for 40% of all deaths. To specialize in these is not a small field, and it's in high demand. Arthritis, for example, if you specialize in arthritis, it's the most common cause of disability. You could create a franchise in every state and every town for the amount of people that need this service, because there is no medication that will cure it. So our session depends on having very clear understanding of what is chronic disease and what is the difference of chronic disease with acute disease, right? In the case of acute disease, for example, our client that comes in that had a car accident last month, there is a trauma of short duration. It's been a month, she probably has inflammation and other stuff going on that she is experiencing, right? And the need is urgent, and it's isolated to that symptom, right? They just want you to help them with that neck area. It's evident that neck area is swollen. You know where it's coming from. But in the case of chronic disease, it's a whole different area. So this was actually defined by functional medicine. because Western medicine, standard Western medicine, tends to treat chronic disease in the same way as acute disease. If you have, for example, diabetes, they will isolate and treat the symptoms of diabetes, only focused on the symptoms of that disease. But if you look at and consider functional medicine started in the 80s, and they decided to focus exclusively on chronic disease. They said, we have an issue and it is not being addressed properly. So functional medicine defines chronic disease as a lifestyle-related disease of long duration. Not only once you know you have the chronic disease, you have it for a very long time or for the rest of your life. It's actually in your body months and even years before you detect the first symptoms. And functional medicine defined it as it is personal. It needs personal care, not just of the symptom, but of the whole person. What needs to be addressed is their environment, their lifestyle, their life experiences, and their particular genes. This distinction between acute disease and chronic disease will actually determine the strategies of the processes, NLP and hypnotherapy and whatever else you have, that you will use with your clients. So in the case of functional medicine, what functional medicine defines is when you've got an acute disease, it just happened, focus on reducing and removing symptoms, period, right? If someone's having a heart attack, you're not going to talk to them about their relationship issues. You're going to address the symptom right now. But when it comes to chronic, once they are defined as chronic disease and there's no longer a threat of a heart attack, then the treatment, lifestyle treatment, sorry. I really love this distinction that functional medicine has, because we fit in this area brilliantly. Functional medicine has determined that there are two areas that need to be addressed. There is the external environment. So there is physiology. So you have nutrition needs to be addressed, detoxing, genes. So now they're seeing that it is less than 10%, even about 2 to 5% genes. And of course, exercise. But there's a whole component that is our field and our specialty is to address the big traumas, events or accidents, things that happen in the person's life, the little traumas, which are more silent, but really affect the body and really affect inflammation, which are not being seen as a child, loss, feeling of abandonments, verbal abuses, right? And then what is called adverse childhood experiences. So these, whenever we do regression therapy, we find these, right? Adverse childhood experiences. There are studies that prove that 2 or more adverse childhood experiences, 2 ACEs, will actually increase the risk of autoimmune diseases by 100%. And 6 or more adverse childhood experiences can reduce a lifespan by 20 years. Craig, do you want to mute yourself? I can try, but.
So if a person has a heart attack or diabetes, does that mean, is it a direct correspondence that they have an ACE of 3 or 4 or 5 or 10? Or if they have a high ACE, is it going to be manifest in the body with a chronic illness? And then the second question is, chronic illness is defined by not being treated by medicine, then why in the dickens are you giving heart attack victims blood thinners, you're treating them with medicine, you give them statins to lower cholesterol?
Yeah, it cannot be cured.
Cannot be cured.
Yes, so
what's treated, not cured.
Exactly. So what is being treated are reducing and removing symptoms, but the disease itself is not being cured.
For me, I've attempted to re-imprint myself, do my own regression. I mean, that works like, you know, eating sawdust. It just doesn't work.
Yeah.
So I guess there's times when you just flat out need somebody that knows what they're doing.
Yes.
Because I'm too fast to pin myself down, and I can't see beyond, you know, that dissonant stuff.
Mm-hmm.
If there's an answer out there, and if it's runs into my fixed belief, you can forget about me.
Yeah.
Even considering it.
Yeah.
And yet that's exactly what we need to do. I guess that's really what I'm looking for in this course, is how to drop the dissonance, not just for myself, but for others, so that we can be receptive to the answers and get on with things.
A lot of what will come out as you address the mental, the psychosocial, psycho-spiritual factors, it is areas that the client, it is so out of their awareness, like cognitive dissonance. It is so out of their awareness, the things that are coming out. For example, you need to let go of the fear of failure. They're like, oh yeah, that's interesting. There's no way. But if you know that their body is telling them they need to let go of the fear of failure, as NLP and hypnotherapy practitioners, you have processes to do that, right? If you notice that there's insecure attachment styles, there's very strong codependence, I am here to make you happy, or I can't be happy if my husband's not happy, you have processes to, you know, to cut those cords, to build the person up, to have resilience, to have stronger boundaries.
So if I'm diabetesing at an average of 240 or above, regardless of whatever meds are given, then does that mean that does that point to ACEs? Do I have ACEs in the hole that cause chronic illness? I mean, just based on results?
Yeah. You might have ACEs, you might have emotional repression, there might be insecure attachment styles. Your body might actually be talking more about the future than the past. And that is one of our distinctions in this work that we're going to be doing, is it's not always past-based. The body a lot of times will steer you towards where you need to be developing as a human, where you need to be more balanced.
Okay, thanks.
Fortunately for us, the indications that there are traumas and ACEs and emotional repression and insecure attachment styles, there is a lot of evidence-based research that is indicating the necessity to work on these psychosocial factors. We don't have to prove that the work we do is needed. That's already there. We can prove how effective we are, but the need for it has already been proven. Okay, so a little quote from Gabor Mate. This is a book called When the Body Says No. This is a great book to see the research on the psychosocial factors behind different chronic diseases. And he talks about it as well. He says cancer, multiple sclerosis, rheumatoid arthritis, and other conditions we've examined, they are not abrupt new developments in adult life, but the culmination of lifelong processes. When your client comes in with a long-term chronic disease, it is not something that happened just 2 days ago or 2 years ago when they first discovered the symptoms. These are culminations of lifelong processes, lifelong core beliefs. All right, so apart from this distinction of what is chronic and what is not chronic, when I started specializing in medical hypnotherapy for chronic disease and took classes from everybody to find out what is everybody else doing, right? What are they using for chronic disease? And I found that there's about three different styles. I called them in the manual 3 different generations, because that first generation was definitely prevalent like 70 years ago. That second that you'll see was from the 70s, from the 80s. And then what we're going to be mainly focusing on is much more recent. So what I discovered as I was studying was that we have these 3 different ways of working with chronic disease within the NLP and hypnotherapy practices. All right, so you'll have a group so in that first one it says symptom management. In that group, the practitioners and of course the clients, and most of society, is working under the paradigm that disease is the enemy, that disease is the problem. I actually went to an amazing class last year on trance work, and I asked a question that we were referring to problems, and always, you know, when a client comes in with a problem, don't get stuck right there. There's always a deeper problem to research, et cetera, et cetera. And someone talked about a pain, a back pain or something, and so I, raised my hand and I said, so what is the problem behind back pain? And the teacher immediately fell into, well, back pain's the problem. Because that's our tendency. When we have a disease, when we have a disturbance in the body, all we want to do and all our clients want to do is get rid of that disturbance. So in that first group, that first generation, the disease is the problem. The strategy is get rid of it. Get rid of the symptoms immediately and as quickly as you can. 3 to 4 sessions preferably, right? And the paradigm under that group is that the body is somehow broken. Something is wrong. Something is wrong with my nervous system, right? Something is wrong with in Parkinson. Something is wrong with my brain. It doesn't create enough dopamine. Something is wrong. And so if you're working under that paradigm, what you're going to do is try to reduce and correct the symptoms. So in this field, what I noticed and what I learned from them is a lot of suggestion work. Suggestion to lower the dial, lower the blood pressure. Suggestions to go into a control room, again, and manage the dials of the body, right? You're correcting an error. Also, just symptom reduction, like putting your hand in an ice bucket and imagining that numbness then coming into the neck pain that you've been having for 30 years, suspiciously recurring every few months, especially around Christmas. Yeah, and then, for example, with NLP, it's noticing the color of it, noticing the shape, changing the shape and the color, right? Or if this area is comfortable and it's a very nice color and this area is a color red, it's moving the color. Different ways of reducing symptoms. Does it work? It can. It can be quite effective. But is it really dealing with the disease? I don't think so. It's almost like turning off the light indicator in your dashboard. Yeah, it no longer bothers you, but has it really resolved what's happening and what's been happening in this lifelong process in your body? In the case, if you guys remember, I mentioned the Raynaud's. In the case of Raynaud's, I did the allergy process for the Raynaud's, for the fingers, and this client had no more Raynaud's experiences for 2 whole years. The thing is, after 2 years, she did a crazy thing. I finally realized Raynaud's has a bit of a crazy thing, not taking care of, being a little more risk taker than you need to be. But she did a crazy thing, going outside, very unprepared, wearing pretty much summer clothes when it was very, very cold outside, getting a little nervous that she was unprepared, and her Raynaud's started coming back again. So yeah, you definitely wipe it out, but if you put the environment, once again, those psychological triggering factors, her Raynaud's creeped back a little bit. So for me, that indicates we got rid of a symptom, not got rid of the disease or the mental state from that disease. The second generation, which is quite prevalent now, is the generation that defines disease as most disease are caused by emotions. There's actually a book called Deadly Emotions: anger, grief, rage, fear. And the strategy under the second generation is remove the emotions behind traumatic events, find that initial sensitizing event, that event that happened possibly at 5 or 7, whatever age, in a really early age. If you can go into that event through regression therapy and resolve it, you have resolved what triggered the disease. Another part of this generations, I notice that the subconscious is not the friend here. The subconscious is needing to be reprogrammed. First generation's the same thing. The subconscious needs to be reprogrammed. It is self-mutilating yourself. One of the very known specialists in this initial sensitizing event is Stephen Parkhill. He has a training in a book called Answer Cancer. The thing is, when you think about what we looked at, the psychosocial factors, if there's a big T, this probably can be very effective. If there's a little t, right? Not healthy relationship styles, family system issues, not being seen as a child. A lot of those, it's not one issue. And that is where I feel that there's more to be done there. So again, in this one, the strategy will be resolve emotions in whatever way. If I can go back in regression, or I can ask the subconscious to erase all the emotions of all the events that have anything to do with this disease from the past. And again, this generation, once they've done the catharsis, then goes back into suggestions to activate the immune system soldiers to attack cancer, for example, right? The thing about that is, again, cancer is considered an enemy. But is cancer really an enemy? If cancer is really your own cells, you are having a suggestion of a part of you attacking another part of you. So there's some questions arise. Again, is it effective? Yeah. There's definitely been quite a few shifts in diseases and cancers utilizing this method. Does it resolve the underlying factors? Not always. In this case, disease, again, it's a problem. It's something negative that happened in your life. And all your life experiences are something negative that you just want to get rid of, right? So it's almost a victim mentality. So then the third generation, in which I didn't find many, and this is where we're going to really focus on, disease is not the enemy. It is not the problem. The disease is actually a guide that points to the real problem, to the situation. Disease is not bad. The body is not broken. My favorite question to ask a disease while in trance, and to ask a body while in trance with my client, is I will ask the body, so, are you broken? And my client will get that question, and then they'll be like, ha, my body just laughed at me. It's not broken, it put it in, it can take it out. So it's a very different paradigm under which we're going to be working. And our strategy is not going to be focused on getting rid of symptoms. If your client comes in with a lot of symptoms and is very uncomfortable, you want to reduce those symptoms. But your main work is going to be on healing the person, working on the lifelong experiences, working on balancing the person, on figuring out the shadows, the unresolved stuff. You want the person, your strategy is for the person to become whole and balanced, to become true of themselves. So our main paradigm under which we're going to work is what we just addressed before. Chronic disease has a very important psychosocial factor that has to be addressed. All chronic diseases. I will have students come in and say, well, I understand how multiple sclerosis has a psychological factor, but my back pain from when I was 20 lifting that couch, that's all physical. That's this disc and that's this da-da-da-da, and it's a stretch, especially when we're looking at ourselves. It's a stretch to understand that they all have psychosocial factors. That student, and probably most everybody in this class and out there, has had to move. has had to move a bookshelf, has had to move a couch. And we've all gotten that little twinge. And not all of us have kept that twinge for 30 years. The person who's kept it, there's more reasons behind it. There's actually a great book. Has anybody read the book Back Sense by Sarno? He said, well, whenever someone has a backache, of course, his health practitioner team, his doctors, will do an MRI and say, oh, of course, look, you have a backache. This is, you know, you have a crushed disc, and you have this, and you have this. And so the person's like, oh, that's why I have a back pain, right? I need to fix those elements. But what Sarno did was he also did MRIs for people that have never had a back pain in their lives. And what he saw was that those same people also have slipped discs and crushed vertebrae and all the other misalignments that people with pain have. There was something else causing the pain. Life, you know, getting older causes all these things happening in our backs, but our backs take care of it. We don't have to feel age, you know, only if there's other elements that our body needs for us to correct will we feel the pain. He actually also saw that muscles will intentionally remove the oxygen, and certain muscles will be cut off, and it hurts. But there is nothing physical. Of course, the oxygen has been cut off, but there's nothing physical cutting off that. The body has intentionally cut the oxygenation of certain areas, causing discomfort. They all have a psychosocial factor. Keep that in mind. Also, keep in mind the disease. Though your client's going to come in and say, I want to get rid of this, the disease is not the problem. It is only pointing to the problem. Okay? I invite you guys to get the list of all the NLP presuppositions. And if someone can hang that onto the forum, that would be great. And I want you to review them and consider disease just as any other issue a client comes in with. And I posted a few out here. Can anyone explain the presupposition of NLP behind every behavior is a positive intent? I remember in my NLP training, our teacher, of course, was trying to shock us. And he said, even if you have a guy who straps bombs all around his body and goes into a school bus and blows himself up, even that person had a positive intent. It was the best solution he had at that time. And of course, the whole class was quite in shock, going, oh, how could that ever be a best solution, right? But then we broke it down and thought, okay, yeah. Evelyn, would you
sorry.
elaborate?
I wanted to mention, as just get on what you just mentioned too, it is the behavior of the person. It's not the behavior, it's about their intention. So piggyback on your story, another quick story is a robber can come into a house and his intention is to take the TV because he needs a TV, he wants a TV. So the owner of the TV is standing in the way. The robber shoots the lady, the owner, and the police asked him, what's the reason that you shot the woman? And his answer was, because she was in my way. So his intention was, the intention is for the individual.
Yeah.
So his intention was because I wanted an equipment, something good for me, but it's not for the intention for the other person. Yeah. So every behavior has a positive intention. It's not necessarily for the other person, but it's a person that's actually acting on.
Exactly. And in that particular moment, that was his best choice.
Right.
Exactly. So we need to do the same with disease. From the outside, we might think, oh my gosh, a cancer. But the body has a positive intent for putting a cancer in place. And a cancer is nothing more than your own cells, a group of your own cells deciding to be more prolific, to take as much nutrients as it can, and to not consider, you know, the cells around them, but they are your cells. Even when, because, you know, even when you have, you can say, oh, of course my cancer comes from because I was smoking for 30 years, right? We will say, well, you know, a lot of cancers aren't just have a mental component. If you smoke all your life, of course you're going to get lung cancer, right? But I wanted to read from the book, When the Body Says No, to again shift your paradigm. There's chapter 7. Dr. Mate says, smoking no more causes cancer of the lung than being thrown into deep water causes drowning. He goes, just the logic alone that if A causes B, then every time A is present, B must follow. If B does not follow consistently, then A cannot by itself be caused by B. What he is saying is, just because you smoke, you do not need to have lung cancer. The majority of lung cancer clients will have been smokers, 87%. But guess what? Of all the smokers, lifetime smokers, less than 10% of them get lung cancer. There is actually a higher probability of establishing lung cancer. The single greatest risk for death of lung cancer was anti-emotionality and the repression of anger, much more so than the tobacco. So again, in all diseases, there's a major mental component and there's a positive intent behind that component. The other NLP presupposition that I pulled out, because this was another one that's going to really require a shift, is that people work perfectly. No one is wrong or broken. It's simply a matter of finding out how they function now so that you can effectively change that to something more useful and desirable. People don't need to be fixed. Find out how they are working. Remember, in any problem, what they're coming in with is actually resolving something. Find out how them being stuck, them having a cancer, them procrastinating is actually solving something, and then find another way to solve it for them that's more desirable. The body is not broken. Yes, Craig, can you unmute yourself? Easier.
So this presupposition throughout the years has, I don't know how, there's something about it that's, my understanding doesn't quite, I don't know, doesn't quite understand, or it's slippery or whatever. People don't have to be fixed. No one is broken. People work perfectly. And yet, if you don't change, you'll injure yourself or you're dead. Mm-hmm. So a perfectly fixed, a body that doesn't need to be fixed can be deadly. That's where I run into it. I mean, it's like, okay, your glucose is 666, and if you don't change, in the next couple of days, you're going to go into a coma and you're going to be dead. Or heart disease, you know, it's clogged up and they got to put a stent in. Your body's perfect. Well, it just looks like a lie. It looks to me like you're looking at reality and denying reality and making some kind of fancy little statement that doesn't really reflect the way things are. Because if you don't do anything to fix what is perfect, you're dead. So help me out of my little conundrum here.
Okay. Does anyone want to try it, or this one's quite a stretch? Yes, Kate. Unmute yourself because it's a little, yes.
So I guess the way it makes sense to me is that, yes, you can die if you don't make changes to the body, but the body's ultimate goal is more than just maintaining physical life. The ultimate goal, it has multiple levels, emotional, spiritual, awareness, all these things, and there needs more than the physical to survive, like needs for connection, needs for love, things like that. So the way it makes sense to me is that the body may respond in a way that's harmful to physical life in order to try and get the attention to make the change to meet these other really vital needs.
Yeah. Yeah. I would, yeah, exactly.
So it's perfect in its brokenness?
It is perfect. And okay, so for example, if I am pushing a ball and there is a hill and I am pushing that ball, what will happen to that ball when it starts getting down the hill? It will roll, right? It will take quite a hell of a momentum. And at the end of that hill, it might crash and explode. The ball is functioning perfectly. The ball is rolling as it should. The ball gains momentum as it should because of gravity and the fact that I pushed it and the fact that the slope has changed. The ball is not broken. The fact that I'm able to push, none of those things are broken. But perhaps I desire not to have a ball that exploded. I desire to have a ball that is one piece. So I need to maybe modify my behaviors with that ball so that it doesn't do exactly what it needs to do, which is, gain momentum as it goes down that hill until it crashes and, breaks into a whole bunch of pieces. This one's quite a stretch. That's why it's like, hold these presuppositions and watch them unfold.
Can I jump in real quick? You guys,
Yes.
since you can't see me, I thought I'd just interrupt real quick.
Yes, go ahead.
I believe it's the word fixed. We're
Yeah.
not fixing anything.
We are not.
So it's, because it's the language and the words that we use. So as you're on the slide, you said our body is not broken. We're not broken. So what happens is our environmental, where we're at, what we put in our body, what we, the emotional part of it, people we deal with. And there's certain things that manifest within ourselves. So we're talking about mind and body connection. And the healthier your mind is, your body is healthier. And so we're not fixing anything. I think the word will probably be more part of relieving and letting go. Instead of, because as you mentioned, Eva, earlier, the disease is a signal, it's a message. It's just telling you something is not right. It's not about you as a broken person per se, but it's more about a signal where you need to pay attention, what is going on. It's just a message for you. It's not, we're not fixing anything.
No, yeah, we are transforming.
Right.
And yeah, yes, if I keep pushing that ball, of course that ball will die, let's say, at the end of the hill. There's nothing wrong with that. It's perfectly functioning, both myself and the ball. If I don't want that, I need to transform the behavior. I need to change the behavior. I don't need to be fixing. And it is a stretch. I will go in and speak to the disease and I will say, but if you keep going like you're going, to the disease, if you keep going like you're going, and the disease is like, well, I'm responding to what I'm responding, but I'm like, but if you keep going like you're going, my client is going to die. And the disease is like, yeah, what's the problem with that? And of course, I'm like, what do you mean? And my client, of course, what do you mean? As Kate said, that is not the goal of the body, of your subconscious. And I think I have it. Let me see if I have the next one here. Yes. The goal of your subconscious is not to keep your body alive. The goal of your subconscious mind And I want to remind you guys, this is what I tell my clients is I say your conscious mind is kind of this frontal lobe. It's like this little area here in the front of your head. Let's just say it's there. I'm not really sure where it's there. But I tell them your subconscious mind starts from about right your forehead all the way down to your toenails and probably kind of around your body. Your subconscious mind is not the one that needs to be reprogrammed. Your subconscious mind holds all your beliefs, but your subconscious mind also holds all the universal truths and holds what you are here to develop. And your subconscious mind will do whatever it needs to do in your physical body, in your relationships, in events and experiences you have to balance you back out again. And if that rebalancing ends up killing you in the process because you are so hard-headed that you need to eat that pizza from Costco, yes or yes, well, it's going to keep doing what it needs to be doing.
So, so what I heard you and Evelyn and Kate say,
yes,
any process, a disease is a process or a message, and that works perfectly. And I then am attempting to get the message, and if I don't, it might ramp up and become more deadly because I haven't gotten the message. And all of that is working perfectly, hence the body is perfect, even though I might be in a disease state because a message is attempting to get my attention. And then as coaches or facilitators or whatever, we are then assisting them in reframing the message to get the same message without being so deadly and do it in a more judicious manner.
yeah, we will take
Right.
the message, we will take the balancer from the body and put it into mind, right? Put it into lifestyle.
Okay, I'm in, I want this. So all the back pain, all the diabetes thing, the heart attack of my wife, if I could help her,
Yes.
it's becoming a little more informed and expert at helping them find the message in a different way and then having the symptoms abate and go away.
Exactly.
Maybe they get it because they're sweating instead of cancer. I mean,
Well, if they're sweating, it's less than 3 months. It's
sweating is a lot less deadly than cancer,
It's not.
but all of it is perfect.
Yes.
So that's what so it's almost a reframing of disease is not something to kill, and disease is not the body being broken.
Nope.
A disease is merely the body working perfectly to deliver a message.
Yes, it is pointing.
Thank you. Thank you,
to
Kate and
what
Evelyn.
you develop. Exactly. Yes, Rebecca, Becky, can you unmute yourself? Well, I'll try from here, but.
I got it. I got it. Can you hear me now? Okay. In the beginning, when you defined chronic disease, you said it is not viral or infectious. Now, I know they've come up with a medication now that cures hepatitis C, but Hep C for a long time was extremely chronic. So do those infections and viruses, do they not have a message or a purpose for being there?
They actually do. The most interesting conversations I have had in trance has been with the HPV virus, has been with Lyme.
Okay.
But focusing most chronic disease is defined as a non-viral. So for us, we are not trying to find an external culprit. The body might utilize. You smoke and it needs you to learn something, it will use it because it's in his menu. You have emotional issues or are the doormat of everybody in your life, and you have the gene for breast cancer, your body will utilize that gene. That gene does not cause the breast cancer. That gene is on the menu for your body to utilize to express needs of balance.
So the way that we're going to learn to go through these processes would still work on someone who had a viral or infection or, okay.
Yeah.
Okay, that was what I was wondering. Thank you.
Yeah. But we want to also educate our client, because I specialize mainly in multiple sclerosis, and I'll have a lot of my clients that come in going, is my multiple sclerosis caused by Lyme? Is my multiple sclerosis caused by Epstein-Barr virus? Your body might have used those components because it had it available. But think about, for example, when you get a cold or when you have the flu, right? If someone were to examine your lungs in any moment of your life when you don't even have the flu, you still have most of those viruses within your body. But when you have the flu, that virus got activated. Your immune system actually stepped back and allowed the virus to proliferate. But the majority of those infections, viruses, and bacteria are already within the system. You can have the HPV virus for years and not have it activated. And then one day, the immune system steps out of the way and allows the HPV virus to proliferate. What triggered that? That's what we are going to work on. What caused the body to decide to allow that to be expressed right now? There's a lot of, I remember my grandfather's eating habits weren't that great. He lived to 98. We are now in a society that, fortunately, we are finally determining that nutrition is extremely important, right? Fortunately. But the body will use your malnutrition, will utilize it because it's available. It is not necessarily the direct cause. I will say it is not the cause, but I have to be careful with that. So I'm just going to say it is not necessarily the cause of what's happening in your body. Your body will take care of it. Just like the back, slip discs, and there are people with some arthritis that never feel anything. Your body will take care of it. There are people that smoke for 50 years and never develop anything. Your body will take care of those toxins and take care of them and take care of them and take care of them until it decides it's going to utilize it. It decides, no, you need to balance this, this, this. I'm putting this in place. Your work now. So another part of our paradigm, and what we're kind of alluding to now, is disease is not random. It is meaningful. Okay, and that's what we've been talking about right now. And what I just talked about now, the mind, subconscious, superconscious, whatever you want to call it, I put it in capitals. It's not the subconscious mind that has only beliefs and behaviors that are patterned. Our mind is both part of the cause and will be part of the healing of whatever ails us.
Hey, Eva.
Yes.
On Rebecca's point on the Hep C,
Yes.
with meds that appear effective, and then our previous conversation that every disease has a message. It appears to me that the implication is that if we provide meds on Hep C and get rid of it, quote unquote, then if the message hasn't been received, it'll just pop up some, you'll have Hep D or Hep E or Hep F or
you'll have the worst relationship you've ever had.
Right. It just seems that if the issue isn't handled, maybe it's handled by meds or whatever.
Yes.
But your point on the message, if the message hasn't been received, then it's just obvious to me that something else is the wheels are going to come off somewhere else.
Yes.
Yes? No?
Yes. I had a client who had tons of allergies. And of course I was on a roll because it was the very beginning of my training and everything. And I was doing the allergy process on everyone, right? So I removed all his allergies. I was successful, right? No longer a symptom, I'm successful. 3 years later, he got the client from hell. We called her Cruella de Vil. It was terrible. She went after him. She took him to court. She totally unjustified everything she wanted to do. But what we figured out was he had lived his life always with a rule that if I'm nice enough, everyone will treat me nice, right? Always saying yes. And his allergies was one of the few places in his life where he was balancing all those yeses with a no. He was able to say, no, I'm not going to your house because I've got allergies. No, I'm not doing that because I've got allergies. No, I'm not eating that because I have allergies. It was the only place in his life he said no. It was actually balancing him in a twisted way, but it was balancing him. It was giving him the ability to learn to say, no, I'm a priority. I can't breathe if I go there, right? But when I, as most, eliminated that allergy and, several allergies and said, I'm successful. 3 years later, he had another life experience that was going to teach him how to say no. And I think it would have been better if we would have learned earlier. Because allergies aren't as, detrimental as someone who wants to practically, right, take your home away. Our points. The disease is not the problem. It's going to be pointing to the problem. It holds a positive intent. We need to understand what that positive intent is. It is not broken. It is not indicating something that the body, for example, is broken. And it is definitely not the enemy. Even when it's the big C, it is not the enemy. So, what is positive about disease, right? And what is it balancing? So this is just because images are worth 1,000 words. Our client is going to come in, it's there on the left, and they're going to say, my life is fine if it wasn't for this disease, if it wasn't for this hip issue and these constant migraines. Please get rid of them. But when you start working with them and you work internally, you will find that those two elements are a reflection of a whole bunch of other stuff that's happening within their lives. Relationship issues, the need to be perfect, the fear of stepping forward, etc., etc. And what you are going to do is develop them as humans. You're going to develop them consciously. Because once you have developed them beyond their current beliefs, core beliefs, strategies, life strategies, it doesn't matter what else happens to them in the future. They can lose a job, they can get a divorce, they can, any other life situation that we all live through, they're going to live through it fine. Because internally, you have created stability. So we're going to be using disease as a guide to indicate to us, the disease is actually going to tell us where we need to help our clients learn, develop, and evolve. In a sense, we are actually deprogramming the mind, right? Not reprogramming the mind. We're removing all the societal stuff, relationship stuff, family stuff. We're removing all of those things. And the uniqueness of our practice, the uniqueness of our skills, is that hypnotherapy and NLP, but especially hypnotherapy, can allow us to go in and talk specifically to the disease and find out, what are you reacting to? What is imbalanced in this person's life? And then NLP can help us shift that. Because what will happen, I think I've got it here. Yeah, what will happen with your clients is we'll go in, we'll talk to the disease will tell us what is going on, but it is so far beyond the rules your client has been living with all their lives. To be told by your disease, you need to be able to say no more. You need to have your own personality rather than being nice is not always good. That is a hard one to learn because your whole life is based on that. But because of our skills, we can help that person develop that resource. We can help them see when that doesn't work. Okay, so I drew this out. This is kind of our strategy. Your client is going to come in with symptoms, right? If their symptoms are very loud and very painful, you don't want to leave them there, of course, because they won't be able to do the deeper work. So you will start in the first sessions by doing some symptom reduction so that they can sleep better, right? So that they can move around better. Once you get them in a better place, you're going to start doing the deeper work. And your job will be, and that's why I put here your job will be to determine those, technically speaking, psychosocial, psychospiritual root causes. And it is important that you recommend to your clients that they do the other root causes as well. Because if you're working on all the mental stuff and they're still drinking or they're still eating gluten and their body, specifically, not everybody, but their body gets triggered or develops inflammation due to gluten, that's not helping them. So you need to recommend to them that they get the physiological also taken care of. You know, I always tell my clients, we're tending to the soil. We're going to pull out the weeds, but you need to make sure that's a pretty healthy soil, right? You don't want to, be pouring all sorts of toxins in that soil and then wonder why, after we pulled all the weeds, the body, the new plants are not kicking in. So our goal, or your goal with your client, will be, as Kate said, not just physical wellness, but physical, emotional, and spiritual wellness. So in summary, our job as medical hypnotherapists for chronic disease is going to be to develop the client at a conscious level in the area that their disease, because if not, then you go to psychotherapy and you could there's like a menu of things you can work on, but their disease is going to tell you specifically, and it's so within their shadow, they're not even going to have an inkling that that's what it was. Their disease is going to tell you specifically the area of development that they need. And you're going to help them develop in that area. Because without you, it is, as Craig said, it is impossible. You can't see it. You can't see where you are undeveloped, right? You can't see where something is within your own shadow. So I had a few, unless anyone has any questions, I had a few questions for you guys to answer from what you learned today, to see if we can start bringing our focus into this area. Craig.
Just a quick comment. You talked about the different generations, which I really like. And I haven't been around hypnosis that many years, but it looks to me like it's sort of it's gone through its generations, just like the medical. So, initially it was the hypnotist, I know everything, you know nothing. And then as time went on, it was more like, well, I know a lot, and I admit that you may know some things too. And then the latest is sort of like, I know nothing about your issues, but you know everything, and let's get to it. I don't know if that's accurate, but that's kind of the feeling.
If anyone of you guys have done any coaching training, in coaching, that is one of the big pieces, is the person with the problem actually is the person with the solution. You don't have their solution. Within the person is the solution. Within the disease is the solution. You are just a facilitator of a conversation of your client with their life, with their body, with their disease. You are not there to solve. You can reduce symptoms, please do, and we're going to be doing that in the first 2 sessions. But you are there to help develop them beyond that disease state, right? You develop them beyond that disease state. You If the disease says it's about perfection and not saying no, and you develop your client in those two areas, you've taken the job away from the disease. The body doesn't need to keep manifesting it anymore. What for? You've already learned the lesson. The teacher goes, the guide is, done. And another thing I tell my clients is this never, I don't know if you want to say this sounds kind of negative, but it's not. Life never stops, right? So once you've gone through symptoms and you've developed yourselves beyond that, same as you do in relationships and, and events and jobs, life later on will bring you something else. And of course, it always starts light. You talk to someone with chronic disease, they didn't start with MS. They started with IBS when they were 15 or migraines when they were 20. They started with something small and specific. As you do this work, you will notice in yourself and in your clients that maybe a few years later they get, a symptom of something. But if they now know, I wonder why this, why now, and why me, and they actually step back and go, okay, what's going on? They will begin to establish a relationship with their body, and they will begin to understand that their body is only indicating, hey, there's something here to be developed, right? Don't go in that direction. Don't keep doing that. So a few questions for you guys. Yes, Becky?
Got a question.
Yes.
Okay, so we asked the client to take care of the physiological factors. Have you ever encountered a client who will not do that?
Yes.
And how do you handle that?
Perfect. Two pieces come in there. One is several beliefs might be there. I don't have needs. Big belief with MS. I don't have needs. I'm here to meet your needs. I don't have needs. I'm fine. I can take care of, I don't have to eat. I had one of my, one of my clients with MS being a nurse and just not ignoring her body for the whole, during her whole day at work. Not needing anything. I don't have needs. Another one, so that is a belief. Once you work on that belief, then it's easier for them to start addressing the psychosocial, the physiological, right? Okay. Also, the ability to say, hey, I need to take care of myself. No, I don't want to go every night out. I need a day or two to rest and relax. That you can help them. There's actually a great technique with NLP called criteria, and you can find out what is your client's criteria. Usually a criteria, they'll mental map it. They'll either say like something important is up here or very close to me, and things that are less important are out here or very down or loud. I had a client whose criteria was something that's very important to her is very close and loud, and something that's not is over here. And when we study the criteria, we will find that self-care is out here. It is not an important criteria. And by just mapping it to over here, after death and, and someone else dying, but they're putting their criteria higher up on their scale, they will actually automatically start taking care of themselves more.
Okay, thank you.
But yes, that will be an indicator. You want to ask them, what are you doing? What have you researched? This is their task, not yours. And you tell them, we can do this part, but you really don't want to have the healthy soil while we're tending to the weeds. We might help and develop and really take care of the mental, but if you want your body to self-heal, you want to give it the nutrients, you want to give it the energy to kick back in. So, a few questions for you guys. Your clients say, I just want to get my old life back. According to what we reviewed today, why would that be considered unethical? Now that you know what you know, sorry, but now that you know, why is it now, from now on, unethical to do that for them? Yes, Kate? Unmute yourself. Oh, wait, I'll try. Okay.
Their old life is in alignment with their continued development and that balancing process. So now that we have that awareness that that's the main intention here, that would be us intentionally going against their best interest.
Yeah, we're putting them right back in the problem. All right, next question. How can hypnotherapy and NLP work with cognitive dissonance? I really briefly explored that, but cognitive dissonance is when someone tells you something, you'll see that in politics a lot. Someone tells you something that's outside of your belief system, they will rationalize, to the world and back why that's not true. Because considering something that's outside of your mind, your map or your paradigm will create a discomfort. So why or how can hypnotherapy and NLP work with cognitive dissonance? Because their disease might actually give them stuff that's going to make them feel very uncomfortable. Craig?
Yes, I think it was the class you and I were in when Robert Dilts was describing working with his mother who had breast cancer. And he went over there and said, "So what is it that you want, Mom?" And she says, "Well, I just want my old life back." And he knew that if he helped her do that, it would just make things worse. And so to begin to soften her up, to get, this cognitive dissonance, to get outside of her comfort zone, he questioned her. He said, "Well, what did you used to like to do before you were a nurse?" Because that was her whole life. And before you became a nurse, didn't you have any other interests? So I think it's one of the approaches is to begin to explore other things in their life and get them to answer it. And she says, "Well, it isn't really practical, but I wanted to be an actress," I think is the way it went. And so he began to explore that. So what would that look like today? Well, I'm sort of old in years and stuff. I can't go. But I would really like to do commercials. I think I could just, and then gradually she came up with the idea and got a plan to do commercials, which actually worked, and she was in some, and her old life went away and the cancer left.
Yeah.
So Robert helped her explore other possibilities. And I think that's one of there's probably other ways of doing it, but that's one of the ways to confront this fixation where you won't consider anything else.
So with your question is how NLP and hypnosis can help.
Yeah, cognitive dissonance, all those areas that are so outside their paradigm.
Yeah, with their beliefs, it's with NLP and as well as hypnosis, is NLP letting go of limiting decisions. As you were talking about criteria, in our branch of NLP, we call it personal values. So by finding out their personal value on living, I find very, very interesting that some of the clients that I work with, when I ask them what's important to them about living life, health is not one of their values. So that is a huge clue that there's a reason that they're continuously being on medication or they have diseases over and over again because health is not important. And this is unconscious, of course.
Yeah, exactly. Health and anything below the neck level.
Right.
Is not important. It's like, oh, I'm supposed to, that's just not random?
Yeah. And also most people think when you eat healthy, it's for the body. What you're eating is you're eating for the body and your mind. So you're fueling your mind and the body. And that's, so, and I don't want to get off the subject, but with hypnosis, with NLP, as we know, our language is our suggestions. So as we know that there's people that will say, "Oh, I have a pain. You're a pain in the neck, pain in the ass." So you're giving yourself suggestions already. So by picking out and helping them recognize that the words that they're saying, they're giving them suggestions, and the learnings that they learn during the coaching part of it, which is the NLP part of it, that's great because then you can utilize the learnings and then give it back to them in hypnosis as suggestions.
Yeah.
So it's a great combination to help people move forward.
Yeah. Yeah, this was my hardest learning. So I had been doing this. I studied the suggestions. I studied the, initial sensitizing event. And then I started studying how to actually talk to disease in hypnosis. And what was happening is I was doing a research project. I had 24 volunteers with MS working, talking to the disease. I would have a session, to talk to disease. I would get everything that needs to happen, what they need to let go of. And I'd be like, yes, we did it. Now they know. Now they'll just let it go and they'll heal. And next session would come and some improvements, but they weren't healing. But when I would be asking them about the session, well, yeah, but your disease, your MS said this and it's about this. And I'd be like, yeah, it did say that, didn't it? And at first I didn't understand. I had a client with ALS. It was so clear. And yet, fortunately, she was the one who finally shifted my paradigm. She said, Eva, I understand the reason, but what am I supposed to do with it? And that's when a light bulb, and I thought, oh my gosh, that's why they have the problem. Because the solution, if they knew the solution and they knew that life is supposed to be that way, they would already have healed. It's uncomfortable enough, but it was so outside their map of the world, so outside their paradigm, that of course they hadn't made the shifts. Even though the symptoms were so uncomfortable, they didn't have the tools to make those shifts. And that's what we can do. So another one. How is the subconscious in this third generation hypnotherapy defined different than in the prior hypnotherapy strategies or generations? Marilyn, I see you moving around. Will you quit asking? Okay, good. All right, unmute you. Go.
Oh, thank you. So in the third generation, we are befriending the illness. We are looking at the disease as something that is a discovery and is going to point us to openings of insight and communication. Whereas in the earlier models, you're just trying to mute it. You're just trying to subdue it and kind of get it to be quiet and get the symptoms to go away and, turn the dial, get out of here. Whereas this is more like amplifying and really using it for its wisdom.
Exactly. And what is how is the subconscious serving in the third generation, and how is it serving in the other ones?
Well, the subconscious is something that you are really dipping into to both learn from and to teach, both, really, in the third generation. And in the first generation, you're reprogramming the subconscious. You're not really seeing it as a source of wisdom. You're just, feeding it new suggestions and hoping that they stick.
Yeah.
Mm-hmm.
Yeah. Back to our client with neck aches. What would be your approach if it stems from an accident that happened last week, or if it stems from something that's recurring 30 years ago? How would your approach be at least different, if it would be different?
Well, I'm going to sort of answer, but with also a question, I think, because both of them would involve some sort of at least temporary symptom management. Whereas in the second case, it would involve a lot more delving, into the meaning. But I want to say that I don't know how different they really have to be, because couldn't the accident that happened be the trigger for, Like, we don't know that this thing is going to resolve itself in a month versus it might last another 30 years for the science. This might be the trigger that, So at the end of the day, I'm not so sure that they would be different.
Yeah. So yeah, when it's short term, you do want to definitely do symptom management. but you're going to keep your eye open because that might be the first tap the subconscious mind is giving them about an issue that needs to be resolved. Of course, if they never resolve it, they'll continue to have that tap, you know, for the next 30 years off and on. So yeah, exactly. And even with the one who has 30 years, you know, ago, and it keeps coming back, you do want to help them with some symptom management. It is uncomfortable. But if you wipe it all out completely, they won't even remember they had a session with you. So they will not do the deeper work until something else comes back. Craig, you had a question? I think I unmuted.
Yeah. So it appears to me that you're suggesting a different approach for acute versus chronic. I mean, acute just happened last week. So I've got definitely symptom management. Maybe they broke their back or whatever. Whereas chronic, 30 years worth of beating themselves up with a thought that's debilitating and has landed as osteoporosis or something. It looks like you're insinuating a different approach for acute versus chronic. Yes or no? Did I just make that up?
A different priority.
Okay, priority. I don't know the difference between approach and priority.
Yeah, so
but you must be thinking something I'm not.
yeah, so with acute, I'm wondering if that was the first tap of the subconscious. I'm pretty sure it probably was the first tap. But with chronic, I know that the subconscious has been lovingly, you know, tough lovingly for many, many years. But I will have actually, I have gone in and talked to someone who had broke her wrist, and the body says, you know what, sometimes we get overwhelmed. It was a skating accident. Sometimes we get overwhelmed. And what it did suggest, which was beautiful, is the subconscious, and she was not a hypnotherapist, actually gave me suggestions to accelerate her healing. And said, slow down. Forgive yourself. Accidents do happen. It doesn't have to be anything large. Roll with it. You know, it was beautiful. And probably 10 years from now, you'll say, hey, which hand did you break? And she'll be like, I don't know, wait, this one, there should be a scar here somewhere. They won't have that recurring ache. Body won't need to use it. All right, so bye-bye, everyone.